Welcome to Connecticut eHealth Podcast, educating, conversing, and connecting for better health. The Connecticut eHealth Podcast is a space where we get together with local and national experts, key stakeholders, and other individuals in the space of eHealth to discuss health information in Connecticut and around the country. This podcast is brought to you from the UConn Health Interoperability, Innovation, and Learning Lab, where our mission is to promote the optimal adoption and use of eHealth by providing education and engaging in conversation with leaders to create connections for better health. So let's sit back and get connected. Hello, this is Tom Agresta. I'm a family physician and clinical informaticist at the University of Connecticut Health Center, and I'll be your host for this episode of the Connecticut eHealth Podcast. Today's guest is Dr. Albert Valerian, the Chief Medical Informatics Officer at Nuvance Health, a cross-state healthcare organization between Connecticut and New York. He earned his medical degree from Sidney Kimmel Medical College and completed his residency at Darnall Army Hospital in emergency medicine. He's board certified in emergency medicine, has been serving in his role since 2020. In his past roles, he was Associate CIO and Director of Quality Analytics at Staten Island University Hospital. Al, it's a pleasure to have you join us today. Thank you so much for participating.
Pleasure to be here. Thank you very much for the opportunity. And I've been privileged to be part of the workflow you've done with Connie and CHA as part of our work in Connecticut. And it's an honor to be here to talk about that today.
Excellent. So Al, tell us a little bit about yourself, your background, and how you function as a CMIO for a cross-state healthcare organization. Give us a little bit of history and information about yourself.
Well, it started about 15 years ago. I was working as an emergency physician back in Philadelphia, and they needed someone to really hone in on what we're doing around information, the data. We had a string of books on racks. We look up things, diagnoses, et cetera, but it wasn't facile. It wasn't efficient to care for patients in an ever-evolving, more difficult, complex world and having to rely on books. So I thought about what can we use for computers to do this? So created our own little website, and that's where it all started. It's like, hey, I like what computers can bring us, and let's investigate this. So fast forward, before there was even a CMIO position, we did the informatics, and I became medical director of the ED there back in Einstein in Philadelphia, and then got promoted to CMIO at Einstein eventually. And the rest is just continuing that wave of innovation and desire to improve healthcare through technologies. Back then, it was just a computer. Today, we are in the cloud, and it's great experience to be part of that initiative.
So yeah, you've kind of described a similar journey that I've taken in this essence, when computers were basically just available as information resources, right? And a little bit of computerized physician order entry for medications and things like that, but it really wasn't a whole lot more than that when you and I kind of started in this field, was it?
That's right. And having the bridging or having working in both Connecticut and New York, we have to create a balance of integration. There's legislative issues, there's COVID responses that are different in each of the states, and the clinical initiatives of each of those end users we have to address specifically around their state mandate. So it's a unique position we're in today at Nuvance Health.
You also have sort of some more city-ish hospitals and more rural-ish hospitals, I gather from your profile there, huh?
Agreed. So we have the Danbury side and we have the Vassar and Poughkeepsie side, both more city/suburban areas, I would say. But then we have the rural. We have the way up north, Sharon Hospital, little connectivity. The clientele are more difficult to connect with. So we have to facilitate their connections to our healthcare. We're doing a project right now in telehealth in the box, where they walk into a box located in one of the libraries there, and we help facilitate care through a telehealth integration with our network.
Wow, that's kind of an interesting, overlap with some of the work that we'll be doing with our state around kind of figuring out best options for getting people connected through telehealth. So as a CMIO, what are your particular areas of interest and aspirations around health IT?
From a Nuvance perspective, we have a few. EMR domain unification. So right now we have 2 Cerner instances in our east was the Connecticut side, and our west is the New York side. We have a roadmap now to unify those for the next several years. into a unified EMR. We do have information flowing back and forth based a lot on the work that we've done with Connie to allow facilitation of that information to flow westward from a Connecticut site to a New York site. So now we can have patients moving more agile across our network without that having that technological wall between our two states. The other initiative we started, digital patient experience, obviously is something that we want to embrace the patient with technology to allow them to better access care as if they're accessing Amazon themselves. They can go in, they can schedule, they can use the patient portal, and they can really participate in the care of their own well-being through technologies that we facilitate for their experience.
Yeah, I think we're in the very early stages of a major paradigm shift in terms of how we collaborate with patients as we empower them more and more with technology and lower the barriers. I think you kind of noted lowering the barrier between interoperability between your own systems. So what do you see some of these emerging tools around health IT to be that you can leverage, both for patients and also, as you and I know, physician documentation and physician burnout is a major issue. What kinds of things do you see that are unique tools that are emerging that you might try to take advantage of?
In our evaluation of the clinical experience, we've done several surveys, and a lot of times comes back as EMR being the negative indicator of understanding how the environment is. For our providers is being better facile users of the EMR, but also give them technologies that drive more automation and enhancement for the experience. So we're enhancing the clinical environment by listening to them. We're reducing the burnout by providing them robotic process automation, so automatic automation in med reconciliations, automating the benefit checks that we have, and also notifying patients when I prescribe a medication for them. They get a text message. We've been in a pilot right now and going live in a few weeks. All our patients will be discharged or taken care of. Anytime a provider provides them a medication, they'll get a text message with the medications on them, instructions, and where to go pick it up, that they can facilitate better adoption of taking care of those medications. They also added virtual scribe to our environment. So now we have 50 providers utilizing a virtual scribe platform so they can focus on the patient. They took the doc out of the documentation per se, so that they allow them to take care of the patient rather than having to facilitate just typing on a computer when they're engaging the patient. Again, that's proven very much in enhancing the experience of the patients. There's three pieces here, and this is the theme of my understanding of what we're doing is improving the world of the clinician, the patient, and the operations, the operative leaders who can facilitate technology in doing so. Burnout, we're all dealing with that. We're doing workflow redesign, reduce the care burden. And one of the themes of our KPIs, for me anyway, going in this year and next year, is returning the joy of medicine to the clinicians, the patients, and our leaders. We entered medicine because we love taking care of people, but we built so many hurdles in the way. We have to facilitate and overcome those hurdles. And that's where technology fits in well for all of us, not just the providers.
Yeah, I mean, you're talking to me about something that I've been preaching about and trying to make happen for a while, and that is sort of the high tech permitting high touch. And I love the idea of taking the doc out of the documentation, because the impact of having to document so much of our own experience with the patient is really taken away that high touch. And that high touch is really critical. It's actually what I think is responsible, as you and I know, it's responsible for a lot of the healing, and a lot of the things that come into understanding that patient. Because if you're able to see them eye to eye as opposed to computer to the eye, you can understand when they're having challenges. So that, I think, is an awesome, kind of pathway. So those are things you're doing right now. Tell me a little bit about what you can imagine happening in like 3 years, 5 years that really might dramatically change where we're headed.
Well, we're right now we're building the foundation of future care. So that future care rely on really cloud-based processes. So everything will be there, the PHI, the data, the orders, everything to facilitate access. And that's what Connie has done. Health Information Exchange allows us to build that cloud access so that we deliver care anywhere we can have a connection to a Connie or HIE or our own data lake that we're building as well. Part of the unification process is we're unifying in the cloud, so we have one EMR across our network. Working with our vendor, which is a Cerner platform, working with them and unifying that workflow and access. And then automation, removing the burden of care so that we can help the people have less stress when they go to work, finding, searching for information, doing processes from an RPA perspective, and allowing the providers to say, I'm taking care of a patient, I'm not taking care of data. That data should be automatically given to them when they need. Another venture in the future is clinically specific interactions with the EMR. I'm an emergency physician. I walk into Bay 1, I open up Cerner, and it knows who I am, what I am, where I am, and who is in front of me as a patient. And then it launches information about that patient in a context that I want to appreciate as an emergency physician. Looking at doing so for primary care, ambulatory care, specialty care, acute care, and across our network is the future. So that the computer knows this information. We just have to use artificial intelligence to bring in that information to give the providers the heads-up display that they need when they're facilitating care for that patient. So that's our future endeavor, and one of those we're very proud of working toward.
Yeah, I mean, I hear that, and I kind of imagine the time that you'll walk into the ER with an older patient with mild heart disease who has chest pain, and automatically, before you have to do anything, their EKGs from prior, their lab work that is related to, cardiac disease, their symptoms, and their risk profile, along with an artificial intelligence level risk identified profile for them is kind of laid out, and the orders are available for you to say, yes, those are the right ones, and add, C, so that you don't have to spend the time kind of searching and hunting and pecking and, all that, right? Which is not time well spent when we're trying to really care for patients.
Totally agree.
And often we miss things. I mean, we're human, and looking, for a needle in a haystack can be quite challenging.
And in pressured areas such as emergency medicine, ICU care, time is life. Time is muscle and heart. And those kind of aspects of knowledge should be given to the providers to make better decisions.
Yeah, absolutely. So you span 2 states, and you've seen 2 different models of how health information exchange as both the verb, exchanging information through technology, and also HIE as the noun, the way the organizations for health information exchange are set up. What's been your experience, and what do you learn from that? The similarities, the differences, the things that you're learning about that?
It's understanding what the providers need as the base. So understanding the verb part, I am walking to a patient and I have to take care of this type of patient in my environment. What information do I need and where is it coming from? Because we want to give information that's value add, not a distractor or a deterrent. So understanding what their needs are and where they're coming from is important. For example, we have patients that go from the eastern area into the west, meaning from Connecticut to New York, for rehab. They need to have access to all their information that they were there for days or weeks at that other hospital. And that's where Connie comes in, because we've built in the Connie access so that it's a seamless understanding of where they can open up their chart and see the information from our Danbury hospital when they're over at our Putnam rehab facility, and giving the providers what they need. So now the ED physicians heard this, the intensivists heard this, the hospitals have heard this. We want to do the same thing. So we're done rolling it out. It's now available, Connie, in our New York environment to allow providers to give best care possible across our network. Integrating that workflow is important. We are going to leverage Connie and our EMR to help transfer patients from hospital to hospital as needed, and from different types of care. And that information coming in becomes a very active part of the EMR moving forward with us.
Right. And as you and I know, it wasn't that long ago that primarily that information came through only really in what we call sneaker net, meaning that the patient carried it on their stretcher with them in a W-10 form, and it was paper, even though we had computerized systems. And it really isn't that long ago that that was the way we did that, huh?
Right. I think as we move forward with technology, the cloud base allows better access. That access is going to be gained more and more by patients. So eventually, on their phone, they'll have their health folder right there with their phone, and they can download it to the EMR when they register. So there'll be a lot more facilitation of this information sharing moving forward.
And tell us a little bit about your experience with the New York side, the HIE on New York. Is that something you're actively connected to or working with as well?
We are. So we use Commonwealth across the network to bring in information into Cerner from the country when people come in from other places to us. We use Healthy Connections on the New York side to facilitate HIE connections within New York State and beyond. And then we facilitate Connie coming across to the New York State locations. We have a lot of information coming into the New York State providers. Now, that's the easy part relatively, because the hard part is what do we do with that information? We have to learn how to deduplicate it. We have to learn how to present it in a way that is, like I said before, a value add, excuse me, for the providers to use. And it depends on the clinician. We have vascular intensivists, vascular folks who really enjoy all the procedures we present them, all the laboratory tests we present them, and that's a gain for them. They really enjoy that. And then we have behavioral providers who don't need that. They want to know if they were admitted to the emergency department last week for behavioral health issues. So there's a dyad of understanding. It's the same platform, but the content has to be regulated and appropriately presented for the provider's use.
Yeah, that is an area where I think there is a real opportunity for sort of future enhancement, I would say. So can you tell us a little bit about what kinds of data Nuvance Health is actually sharing back into the Health Information Exchange? Because you've been a real leader in, trying to get right out in front and share as much as you can to help all those providers that you just talked about. Right
now, we're privileged to work with the initial integration last summer to achieve that, the first mandate in September. Since that point, we grew. We have patient demographics coming over. We have CCDs, lab results, radiology results, and all the transcription documents now available in Connie for the network. So we're looking at CCD data from other organizations and utilizing Connie as an in-context application. We're working with other organizations like yourself to really facilitate and participate within the Connie experience so that we have one unified gateway coming in. Right now, we are in the midst of a large anti-fax with an F program to remove CDs, faxing, paper from our environment. We want to leverage the movements that Connecticut has done successfully in moving this initiative forward. So we're working with the message that says May 2023, primary care needs to be connected to Connie. And that would help facilitate the message, at least for our Connecticut providers, that we want to use Connie as the main gateway into our AMR and for our network.
Anti-fax. I like that idea. So many people who might listen to us might not realize that when we digitized medicine, instead of reducing paper, we actually multiplied it in many ways.
We have.
Despite us thinking we were going to be going paperless, it didn't work that way, did it?
No, because the end users still had legacy processes. We could innovate down to the 5-yard line. If that last 5 yards is someone that still wants fax and paper, they're going to send it back to us the same way. So we're utilizing Connie actually and reaching out saying, hey, you are a provider in Connecticut and even New York. We're going to introduce you to Connie. Here's the analyst from Connie. Here's our analyst from Nuvance. Let's work together to change your practice. And one practice at a time, going to the cloud over a course of a year makes a big difference for us from a long-term perspective, achieving our goals to be an anti-fax, paperless environment.
I love that goal. I'm going to take that up and articulate that on your behalf. So this is a good point for us to kind of take a brief pause and listen to that, actually a word from our sponsor, which actually is Connie. We want to take this opportunity to thank Connie, Connecticut's official health information exchange. Connie was established in 2019 to oversee and provide services to support the exchange of health data in the state of Connecticut. Connie is an independent and not-for-profit organization. To learn more about Connie,
please visit conniect.org or go to the show notes from today's episode.
All right, Al, we had a wonderful sort of first half to our podcast. And as we come back, I'd like to have you share with folks a little bit about your role as a member of our clinical advisory council for Connie, the state HIE, and tell us a little bit about your group and your role in that group, and what do you see coming in the future? What have you learned from that process, and and things like that.
Thanks, Tom. It's an honor and a privilege to collaborate with the state's best clinicians and operational executives, really to expand what Connie can do for healthcare overall. Its capabilities for not just the providers, but for the leaders and the patients, because they all work together. Better information is better for all. In the short term, we really want to unify and create the clinician base around this as we move to the paperless environment, like we talked about earlier, is help facilitating the one-off provider who's in their primary care to connect, because that connection is very powerful. It's not just a connection at their level, it's a connection to a common level of sharing data across our network once we become paperless. In the long run, that data that we share becomes knowledge through evidence-based practice. So we deliver better care for our patients. And over time, the experience that we have of a very strong clinical environment based on the evidence gives us the wisdom to deliver top-level care for our clinicians. And that's what we all do that. We don't have 90% of airplanes land correctly. We have 100% of airplanes land correctly. So we need to have 100% of our patients get the best care possible as we deliver that. Adoption is going to be a long-term goal for us. And working with the CHA and our practitioners to unify that common goal will be an honor to work with on this committee. The other aspect is health equity and social determinants of health. Again, we can help use Connie to facilitate those goals as we, one, apply ourselves to some regulatory measures coming down next year, but also be prepared for better care of all patients, not just those we assume have certain genetic backgrounds, but understanding them as the whole, not just a clinical element they are, but utilizing health equity measures and health equity integration into our clinical informatics workflow as informaticists develop the registration process to better align the care we want for all patients of every race.
Yeah, and as you alluded to, just for our listeners' sake, there are several different things that are really going to, I think, really help us sort of achieve a better understanding first. I think the first thing that'll happen is we'll have a better understanding of, sort of health equity, which we all know that, health is not delivered equitably, or at least healthcare is not delivered equitably. But we don't really fully understand it. There is going to be the ability to actually, capture in a standard fashion information about some of those social determinants of health, such as food insecurity and housing insecurity, and pair that against standardized race and ethnicity, background gathering, as well as the geographic location. People that are in certain areas we know are much more at risk, just even from pollutants that they're exposed to in their environment or crime they're exposed to. And I think getting a good handle on that will permit us to collaboratively, think of solutions. And so I think those are great sort of future use cases. What else do you kind of see as maybe, future use cases that, as a member of the CAC, you're going to, help us steer ideas about what should happen with the health information exchange?
I think the health information exchange is the same kind of understanding we have for healthcare that large corporations like Amazon have done for the merchandise industry. Getting availability to the care we need through the cloud is going to be the standard. We will all be moving that way. We are moving that way, and unifying the state of Connecticut, unifying the states around us through the cloud, and eventually unifying care across our country is, I believe, where we're headed. Eventually, I think I see a unified licensure for delivering care across our country, especially through new technologies that were not available to us 10 years ago. What Connie can do for us as it expands its capabilities is help us deliver better care, because now we have access. That access is given to all of our clinicians, not just the ones that are affiliated with large organizations. So being equal, that equity essence kind of helps us deliver equity of data access for our providers, as well as healthcare equity for our patients.
Yeah, and as you know, there is also the upcoming release of sort of patient access to Connie, which I think probably has pros and cons associated with it in terms of having patients have the ability to gather all their data, but hopefully having it presented in a way that is as understandable to them as plausible and possible.
Right. I hope that the connectivity to Connie isn't just local, it's global, that you facilitate access to that information for the patients who allow it, so that someone like myself, a patient in Connecticut, can travel anywhere else. And if need be, they have access to my medical record back at home.
Yeah, I think that is sort of the long-term goal, is to sort of allow the data to be available where you are and where you need it, right? Because I, as someone who travels a bit myself, I know that I've never, knock on wood, needed care in an alternate place, but sooner or later that may be true. So what do you see as the biggest success factor so far in this endeavor since its launch about a year and 2 months ago or 3 months ago?
I think going back to your point from the beginning, it's like a paperless environment was a 15-year ago dream. We're starting just now to help facilitate that to providers. We're looking at gaining trust back from our clinicians to say, hey, technology really can help me. I'm not just sitting in front of an EMR and typing information in. You're giving it back to me. It's coming back the other way. I'm happier to come to work because now I can facilitate access to my information I need to care for my patients. You listened to me and you came through, and that's what Connie has done for us and HIEs in general. But also for the patients now feel that technology has finally caught up to healthcare and is moving at the speed of healthcare. Airline industry, banking industry, car industry, everywhere you look, there's automation, there's efficiencies, and there's design by user so that the patient's experience has become more what they understand it to be and less what was expected through high tech or whatever a decade ago.
Yeah, and for our listeners who don't know high tech was the original legislation that put a lot of resources out and made available to drive adoption of electronic health records. And it was the initial set of dollars that were trying to drive the health information exchange. It was actually very effective at driving adoption of electronic health records in many settings, but not so effective early on in health information exchange because, as Al and I know, the interoperability of data was not really there. The legislative framework and landmine wasn't there. And organizations didn't feel the need to share data because they were still trying to capture patients for their whole set of care. All those things, I think, are starting to shift in major ways. So we are in a very different place in terms of the capacity to interoperate. So can you pick a success story or two that you've heard from your clinicians that have actually utilized the technology so far?
It's really the one of access for patients coming across our network. So there are certain networks that live only within the Connie environment, and they can share that information up and down across in the cloud. We had to transfer that into a different domain, same EMR, but a different domain. That bridge that Connie has provided us in not just data, but information transfer has been a tremendous value for us as a big win for our providers. Because what that does is it gives the understanding to providers that we are one network. We've had two domains and we unified about 3 years ago on paper. We're unifying in the cloud over time for our EMR, but that ability to move those patients across the network really transcended the understanding that we are no longer a hospital or a domain or one side, we are one network. So utilizing technology to be that bridge or zipper of unification really helps facilitate it by an HIE like Connie.
Yeah, excellent. So if you were to kind of because you've done such a good job of adopting across your own organization, and just for folks that don't know, Nuvance Health has been able to share, all kinds of documentation from their electronic health record, such as the discharge summaries and clinician notes, as well as sort of consolidated documents like a CCDA, which for those that aren't aware is a document that contains like a snapshot of a full patient picture in an electronic format. You've also been sharing image reports and actual images. So people can kind of open up an instance of Connie and see, the x-ray of someone that you saw in the emergency room, for example, that had a fracture to their tibia or something like that. And they'd actually be able to see that if they went to another provider who was actually caring for that fracture over time, right? So you've provided a lot of data in. What can you suggest that other organizations can learn from about your success so far in adoption and participation?
It takes a lot of people to be at the table to work together to make this happen. We have a great leader in Ling Han, who's our director of interoperability for Nuvance Health. She's the one who understands where the connections go and where they come from. But there's also excellent leadership on the Connie side, CHA, as well as the Connie informatics area that allows our requests of, can we do this? Can we innovate that? Can we tweak this to better facilitate from a software standpoint what Nuvance has access to? But hopefully those changes can be unified across the Connie platform to better Connie itself in the long term.
So one of the things I hear you saying is that it takes committed collaborative leadership, right?
Absolutely. To understand what the needs are from the different bases, right? The clinicians, the patients, the operations, because operations folks need the data coming in as well as the clinicians do, but they use it for different reasons. So understanding their needs and having that available to them in the way they want to present it in their Tableau, understanding where our patients go, understanding if they leave the network for referrals or do they stay on our network is facilitated through this cloud-based platform that we plug into.
And when you talk about operations folks in your organization, you're meaning the folks that are trying to ensure that the patient receives the full set of care they have, the folks who are aware of like the payment that might come in because of being part of an accountable care organization or quality payment program, things like that, right?
Absolutely. I mean, knowledge gives us the data that we get gives us the knowledge to make decisions that are financially appropriate for creating the future of Nuvance, growing our ambulatory practices, being competitive in the marketplace. We are on the edge of other competitors within our marketplace in Connecticut. So we have to be agile, innovative, and patient-facing and garner that information coming in. From a executive perspective, it's not just the one patient. In the aggregate, the patients overall give us tremendous amount of information that allows us to not only practice better, but communicate with them in a more facile way through health information technology.
Excellent. So Al, this has been a great conversation, and I'm wondering if you can reflect on and think about any words of wisdom that you would want to share, say, for example, with other CMIOs or other healthcare leaders out there that, essentially, what have you learned that they can garner and benefit from?
I think we touched on it just a moment ago. It's the collaboration. We have to have the clinical informaticists, the operational leaders, the IT analysts who understand how this all comes to fruition and work together as a team. And then at Nuvance, we have that team. We work with the Connie side to facilitate that connection. Bringing the clinicians at the table, ask the patients. We test things out with patients. We have a patient advisory council. We say, hey, we're going to put this into your app. What do you think about this information coming in? Oh, that's great, or that's not. We understand that workflow. So we reach out to the end users of this information to see how they like to ingest it, and then develop the pathways from Connie to them through our EMR, through our patient portal for the better access of their understanding. Eventually, it'll all be in the cloud. So with Connie, as we grow with Connie, we want to gain the new automations that are coming in the future, near term and short and long term, but reducing the care burden to allow us to care for patients in a less stressful environment. Like I said from the beginning, is bringing that joy of medicine back to healthcare, and technologies like Connie can help us deliver that.
Excellent. It comes back to my sort of original goal in medicine: high tech, high touch, right? Let the high tech enable the high touch. Don't let it get in the way, right?
Excellent point.
All right. Well, Al, this was a great conversation, and I really thank you for sharing with us today.
Pleasure being here, Tom. Pleasure be working with such a great organization as Connie, and we look forward to even more innovations in the future.
Excellent. All right. Well, take care now.
You too. Have a nice day.
All right.
As always, wishing you the best of health. Your host, Tom Agresta.